To Love Your Prostate, the layman's guide to BPH. My name's Dave and I'm your host. This channel is dedicated to men diagnosed with BPH, which stands for benign prostate hyperplasia, which basically means you have an enlarged prostate and it is not due to cancer. Let's just stress that it's not due to cancer. Now, I want to start off by clarifying a few things. I'm not a medical person. I have no medical training whatsoever. But I do have BPH and I've had it for a number of years, so I feel qualified to speak on the subject. Number two, this channel provides information and information only and no more than that. The views are mine and no one else's, and they may not be medically correct. After all said and done, I am not a doctor. Number three, never change your medications without first seeking the expert help from a medical professional. And this is the important bit. If you're watching this video because you have problems with your waterworks, please don't delay, go and see a doctor immediately. The chances are it'll be nothing serious, but should it be cancer related, you really need to get treatment as early as possible. Remember, early diagnosis, early treatment, usually good outcome, but delay at your peril. Okay, let's have a look here, see what we're going to start with. So yeah, TURP. They've been doing the TURP procedure since the year dot. It's the gold standard to which all other procedures on the prostate are measured. So this is the one they'll look up to. And although they've been doing it from the year dot, it's still being carried out today. It's widely carried out today. It's still the most common procedure carried out in the UK today, and know that around the world as well. It is an invasive procedure. You need to realise that it is an invasive procedure, and it's probably not very patient friendly. If we get time, we're also going to cover HOLEP and green light. These are two similar methods for dealing with TURP, but they use lasers to actually do the removal of all the inside of the prostate, which is what we're going to talk about in a minute. So we'll see how we go. Now, what I'm going to do now, I'm going to show you some diagrams which I've drawn myself. So they're not great, but they're all right. They did a job, and actually these diagrams are in fact very, very good for what they show you. Right, this is my diagram of the prostate and the bladder. You can see on the this one here, perfectly normal prostate, and on the other side here we have an enlarged prostate. So you can clearly see the differences. So let's just run through the bits and pieces we have here. So we have the prostate, that's coloured in orange. We have the bladder, that's this bit up here, and same as there again. We have the urethra running down. That goes out into the penis and away. And this is the bit I want you to take particular notice of. You see these bits in red here, there, and there. They are the sphincter muscles. There's two in the bladder. Well, they're not actually in the bladder. You've got one in the bladder and one just below the bladder. So you've got the internal sphincter muscle and you've got the external sphincter muscle. I want you to pay particular attention to these. Now, what these muscles do is they keep you from peeing yourself, basically. So this one is normally shut, and so is that one, until such time as you want to do a wee. Now, the internal sphincter muscle, this one here, you can't control that one yourself. It's controlled by the brain without you doing anything about it whatsoever. It's a bit like your heart. You know, when your heart beats faster and slower, you can't regulate it. The body does what it needs to do. And this muscle works the same way. The body does that without you having any say in it whatsoever. By contrast, the bottom one, which goes around the urethra down there, that one is controlled by you. So when you stand and go a wee, and you think, I want to do a wee, that's the one that you actually voluntarily open up to do your wee. So that is that. And now, if I move this diagram over a bit further, this is a sideways view of your prostate. You can see your willy hanging down there. Not interested in that at the moment, but this is what we're interested in here. Is this little duct going up here, and this is the sperm duct. Once again, pay particular attention to that. So when you ejaculate, your sperm comes flying up here. It comes down here into the urethra and out through the penis. It can't go up there because this muscle here, this internal sphincter muscle, is closed, and it's closed by the brain. The brain knows what's going to happen. It knows you're going to ejaculate, so it makes sure that muscle is well and truly shut off. Now, if that muscle isn't shut off, what can happen is that the sperm coming out here can actually go up there into the bladder rather than going out via the penis. That's a really important thing to remember, right? So remember those muscles. That's what I want you to take note of. Now, when they do the procedure to open up the prostate, what they do is put a surgical tool up here. I think it's called a resectoscope, something like that, and it goes up through the penis, right away into the prostate and up to about that point there. When they get to that point there, they've got a camera on the end of this so they can see what they're doing. And then what they do is they push up a little cutting device up through here, and they start to hollow out the prostate. Now, I want you to imagine a small orange, because this gives you a pretty good idea of what the surgeon is trying to do. So imagine if you try and core out all the fruit from the orange without damaging the skin. This is what the surgeon is trying to do to your prostate. So he starts at the very top here, and he will cut out this internal sphincter muscle. So that goes. Gone. And he then carries on cutting out all the way around here and round there. And basically, I think, and I'm not 100% sure about this, I don't know if they try to core it all out, but they certainly try to get out as much as possible. Now, so you'd end up with something like that. Now, what they don't want to do is damage the outside edge of the outside edge of the prostate. They don't want to perforate that, so they have to be very careful. And equally, they do not want to damage these two external sphincter muscles down here, because if you damage those, you will definitely be incontinent, because there's nothing to stop your urine coming out the bladder. So now, if we look at our diagram now that the work's been done, we can clearly see that the restriction has gone, and I could probably do that slightly better there as well, actually. The restriction has now gone, and we've still got these muscles here, so we can still control when we want to wee and when we don't want to wee. Now, we've got total control over these muscles, as I said earlier. We control this muscle here, not the brain. Now, there is a problem. This is going to solve your problem, right? Let's not get away from that. You won't have the restriction in there anymore. But it may well give you other problems. Now, one of the problems it could well give you is because it all revolves around this internal sphincter muscle, not there anymore. Because when we ejaculate, now I want to just move this diagram over here and show you another little diagram. Once again, we've got our bladder. That's our bladder. This is our prostate. This is a normal prostate. Okay, it's not enlarged or anything. And the tube from the bladder goes down through the little muscle there, through the urethra, and there is actually another little muscle which I haven't drawn on there. Now that's rather annoying. Right, let's just draw that one in now. So the other little muscle is around about there somewhere. Okay, I'll do it in black. It should be in red, but that's the other muscle. That's the external sphincter muscle. I must colour that in red. Not to worry. Right, that's better. I've actually coloured it in red now where it should be, so we can now see the external sphincter muscle. Now, when you ejaculate, what happens is the ejaculate comes up from the spermatic cord, and it enters the prostate here. Now, it's going at a right rate of knots when it gets here, so it shoots along there into the prostate, and then it can go two ways. It can either go down through the penis, which is where we want it to go, or it can come up through the bladder. Now, what stops it coming up through the bladder is this internal sphincter muscle. So it can't go that way. So it can only go down. So it can only go down that way. Now, when we've done a TURP, you can see back on this diagram again here, that muscle was gone. That muscle was gone. So if I wipe that muscle out and do the same there, like we've done on our other diagram, you can now see there's nothing stopping that ejaculate going up this way, and it can do. It really can. Does it happen every time? It doesn't happen in every man who has this operation. It doesn't. But you can clearly see it can do. And there's another possible problem here. We've now also taken out part of the sperm duct here, depending upon, I guess, how much the surgeon takes out. I mean, we don't know I don't know how much he's going to take out. But that can also cause you problems here. So the problems you may get from this are you get retrograde ejaculation, where the ejaculation shoots up that way rather than down that way. You can get the side effect where you have no ejaculate at all because that's been damaged and it don't work no more. Or you can also get sexual erection dysfunction. In other words, you can't get an erection. That's also another side effect. So none of these are guaranteed to happen, and they probably don't in most men. But you need to bear in mind they can happen. So I think that gives you a pretty good idea of what happens when a TURP is carried out. Well, I think that gives you a pretty good idea of what a TURP is, how it's performed and what you end up with. Now, it's important to stress that all the side effects I've told you about there, they don't happen to most men, right? There'll be a percentage of these, and you need to discuss this with your surgeon, and you need to make sure it is right for you. I'm not going to get time for the HOLEP and the green light today, so look out for them in episode 4. If you try and watch the episodes in series, it'll all make a lot more sense, okay? So yeah, HOLEP and green light in episode 4. You need to watch these because these are a TURP. They're just performed in a different way, and they're not considered to be, they're considered to be patient friendly rather than evasive surgery. So the upsides of a TURP is that it provides a satisfactory result to many men. Okay, many men will get definite benefit from this operation. The downsides, well, it's an invasive procedure. It can be bloody. Some men do require blood transfusions. You will need to stay in hospital. The other downsides are we went through the diagram there and we spoke about what happens when the internal sphincter muscle is removed. So the downside you could get from that is retrograde ejaculation. You may get no ejaculation. You may get the inability to get an erection on. It can happen. So all these things can happen. There's always problems with every operation you do. Now, I've just got an outlined all these. I don't want to frighten the life out of you. I really don't. If your surgeon says to you, look, because of this, that and the other, this is the best procedure for you, well, you'll have looked at my videos, you'll talk to your surgeon, and then you'll make your own decision on things. So that's what these videos are all about. So I'm going to conclude that video now. I'm not going to go any further. Well, I sincerely hope you've got something out of this video. And if you have, please subscribe to the channel and hit the like button. That's the little thumbs up, yeah? Because that really does the channel good. It makes Google realise that people want to watch the videos, and it puts them about an awful lot more. If no one gives it the thumbs up, clearly no one's going to see them, and that won't be any good for anybody. So yeah, give it the thumbs up sign, please. So that's it now. So nothing else to say apart from don't forget to watch HOLEP and green light episode 4 coming up soon. And yeah, that's it. So until the next time, love that prostate.